plan for implementation.
Thank you very much to the organizers to being here today. Oh, sorry.
We just need to put in that pocket.
What's fortunate about being last is that everything pretty much has been encapsulated, said, maybe more eloquently than myself. And some of those charts that you've seen with Sweden really, really small. I was born and raised in Spain, which is really, really, really big. And I live in Italy, which is also really, really, really big as far as antimicrobial use. So I think this is interesting that we are under one sort of umbrella about the European Union, and some of the data that was shared with you talked about this discrepancy. Yet, I would say that this, in such a privileged part of the world, where there is good governance, where it is wealthy, you have this divergence of problems. And so what will it take for us to solve that? So my focus, and I'll go through this a bit quickly, I think, because you've already know some of the stories, is going to focus on the joint action. So in this particular, we know that looking at abattoirs and looking at beef, cattle, and chicken, and the swine, and then looking downstream already where you are already at the retail market, there is a shift. Where has this gone? It's gone in waste, in sludge, in contaminating the environment. And I don't have to go into that because you've had a better lecture than I. But here's a diagram of showing the complexity of the life cycle, of the epidemiology of antimicrobial resistance, or some of these pathogens. So although we focused a lot more on livestock per se, from my perspective on FAO, I need to bring in fisheries, I need to bring in the water, I need to bring in the soil. Lipid antimicrobials do not behave the same way as water-soluble antimicrobials. So it's having the different sectors come together and talk is required, and we'll go into that a little bit more. Now, as you may or may not know, there is a global action plan that was endorsed by the membership of the World Health Assembly in 2015. And the World Organization for Animal Health, the OIE, and the Food and Agriculture Organization helped develop this. So the word animal, livestock, agriculture, fisheries appears in this WHA document dozens upon dozens of times. Often enough, we do see that the physicians are talking about AMR, but don't bring in some of the other sectors. Or we talk about One Health, and it's Wolf and I and Delia talking to each other, the veterinarians. It cannot be that way. We need to be much more engaged. So in 2015, something that had never occurred before is that the World Health Organization, the World Organization for Animal Health, the OIE, and FAO all passed resolutions in their governing bodies regarding this effort, trying to get the political will, the science, the correct science behind some of their work in their diverse resolutions. FAO, we presented our FAO action plan on antimicrobial resistance. At Counts, we have several governing bodies. We are much more complex than the OIE or the WHO because we have one for fisheries, one for agriculture, one for the CFS, for food security, for forestry. So we have a lot of governing bodies. And then we have conference, and then we have council, and we have the programming committee. But I won't bore you with that. But it's important to be able to go through all these steps in food and agriculture, food and nutrition security. Now this is nothing new. This tripartite, as we call it, FAO, OIE, and WHO, in alphabetical order, not to get anybody angry, has been going on for a long, long time. And it's important from the country perspectives and from all the different Stockholms around the world, that those that participate at the governing body of WHO or at the governing body of FAO or at the governing body of OIE do speak the same language, and that sometimes does not happen. So even the governments, of which we're made up of this intergovernmental approach, has difficulties to bring the different sectors of government to talk the same voice to our governing bodies. So in 2010, we reaffirmed this collaboration of the tripartite, and we focused on 3 themes: zoonotic influenza, rabies, and antimicrobial resistance. And this was this document carries a lot of weight. I think it's quite light, actually, in my view. But at least it's been highlighted, and the governments, the Swedens of this world, want to see us work together. We have to work together. We need to. We need to speak with one voice. And so on the tripartite collaboration on AMR, and in passaging the global action plan, which we don't call it the WHO action plan, because then it's theirs and it's not mine. We call it just the global action plan. And it's supposed to carry on what the world needs to do. We've developed the tripartite manual to help countries develop their manual for developing the national action AMR plan, version 1, which is being tested out this year. Now, if we look at the Global Action Plan, the GAP, this is from the World Health Assembly. They have 5 different objectives that they're looking at. And I can identify well, not only did we help write it, but you can certainly identify yourself in many of those, with probably the exception of well, the patient care, pretty much. We on the veterinary sector or in the terrestrial and aquaculture, we would handle it a little bit differently. What we've done with the FAO action plan is to look at 4 different target areas that are coherent with the global action plan. Many of you and some of the speakers here have talked about the importance of communication and awareness raising across the whole scheme. To improve the surveillance. Now, WHO has been very much, and it sounds very good, to have an integrated surveillance. But integrated surveillance is when you have all parts playing together, the same symphony. And the weak sector is usually the veterinary sector or the environmental sector. We don't really know. So we have to strengthen the quality of that surveillance so that we can truly know what a national integrated system will look like. And we're not there yet. Governance, many of you have mentioned the governance, and we recognize that there's governance for the awareness, there's governance for the practices, and there's governance for the evidence. And lastly, if we want to decrease unnecessary use of antimicrobials, we have to improve hygiene, improve best practices, improve upstream preventive measures. And the reality is that we're not there yet on the world scene. Now, antimicrobial resistance at FAO and all the little acronyms here, don't worry about it. That's just the name of divisions or services, but it brings in people that work on development of legal or regulatory frameworks. It brings the communications, corporate communications, people that deal with that rural outreach and extension services, fisheries and aquaculture, plant health, the Codex, which is a FAO WHO instrument on food safety, food safety people, which are not necessarily related to this standard setting body, feed safety, quite important in the animal production group, animal health, the production group for terrestrial animals, and then we have to reach out to the regional and then the national authorities or expertise that we may have. So it's quite complex at FAO. And then with Codex, it's very an important partner to this, because what we do also want to have is protect the consumer. I cannot emphasize the legislation and making sure that Coherence, I think from South Africa, you see all those different animal directives. This this group, the Legal Information FOWLEX, and the Development Law Service, could go there and in 10 minutes to 10 weeks probably make it all coherent. So that type of outreach and making sure that the legal framework between the Ministry of Agriculture, the Ministry of Health, Ministry of Environment, Ministry of Commerce or Industry, that legislation is coherent. That's an important contribution. I'll skip all this part because we already know, well, okay, on the intersectoral coordination, it requires the different disciplines coming together and leaving your logo at the door and being able to really to speak, to get to where the goal that you want to reach. Which could be just the integrated surveillance or the best practices. The blame game that we've had in the past of physicians blaming veterinarians or veterinarians blaming physicians, we don't hear that anymore. And I think that is very, very good. It used to be WHO blaming FAO and FAO blaming others. We've gone beyond that. And so that's where I think the model of Sweden or Norway or the Netherlands or Kenya could be so important for Spain or Italy or others. One big part is, I'm getting away from my presentation. One big part is the impact of antimicrobial use, antimicrobial resistance, and trade. And we already heard a little bit about the TTIP. It's going to happen, and so the world needs to be prepared because it's a reality. So rather than ignore it, start talking to industry. Start talking to the partners. There will be losers and there will be winners, but at the end there'll probably be a better world. The regular framework, we've already discussed it a little bit. Again, it's not only terrestrial animals. I want to ensure the aquaculture is there and the environment and the downstream aspects. Integrated surveillance, I already made my point about the weak links to be able to get to that integrated surveillance. Some of the graphs that you've seen my other colleagues present come out from this document where it's I think it's a model for us to be able to try to adapt this to the other 150 countries in the world. So again, here's me, there's you. Cyprus. I'm sorry. Oh well, yeah, Cyprus. I won't make any diplomatic blurs there. Okay, so I'll be quiet. Communication, let me move through it because I know you're tight on time. The training and capacity building. FAO is we are a capacity development organization. We really, unlike WHO or unlike OIE, my tripartite group, we are really into the rural areas, with the communities. I think we share that very much with ILRI and being able to translate good practices or test ideas out in the field, farmer field schools, people that are able to learn by doing it themselves as opposed to having white men from Europe go to someplace else. So there is the issues are not necessarily technological or medical. They're more sociological, anthropological communications. We've talked, and you'll hear a lot about with antimicrobial resistance, we need to invest in new research. Who says that we shouldn't? Okay. Why? Okay. Well, see, I kind of agree. I didn't know I would agree with you on this one. I think that if I were able to invest in extension services, not necessarily new drugs or new devices, I could probably do a better job upstream on prevention, hygiene, than if I have a new armament of drugs or full genome sequencing in 10 seconds. So there's some things that need to be done. Yes, there's a place for research, but I think that extension services, that outreach, is so much more important than a new gadget. Let me, oh, this is the last slide. I know that you're pressing me, Peter. This is what we are calling the progressive management pathway for AMR to address it. You're in country X, you don't know, you have a problem. You have the UN General Assembly that has just passed this whole declaration, and your president or prime minister, your dictator, has come down on you and you have to do something. You're at stage 0. What do you have to do to get to stage 1? What are the first things? Maybe it's legislation. Maybe it's knowing what you're importing, what you're producing. How many producers do you have? Stage 2, trying to look at to see what's happening in the hospitals and the clinics, or maybe pharmacy sales. So how to help assist countries go up that ladder and become much more responsible. Basta. Thank you. I apologize.